Hello, welcome back to MedSparkle. We often deal with patients who are taking multiple drugs for controlling their blood pressure, but still their blood pressure is high, especially whenever the patient is taking 3 drugs with the diuretics at their maximum tolerated doses and the BP is still high. That will be called a resistant hypertension. The first step with those patients is to check the compliance. Are they taking the drug at adequate doses and frequency? Then we check whether the patient is having some background issues like alcohol abuse, substance abuse, or maybe a secondary disease that's causing the hypertension. After using the 3 drugs, we usually shift the gears and go to the 4th drug, and that drug is spironolactone. And if the patient is having some issues with the spironolactone, like gynecomastia, we may change the spironolactone to eplerenone. Then our options are beta blockers, alpha blockers, clonidine, and potassium channel blockers. The last resort for those patients with resistant hypertension is a renal denervation, which has its inherent risk. So that decision should be taken after a multidisciplinary meeting. That's it. That's the management of resistant hypertension. Thanks for watching the video.